I'm Dr. Jeannie Doig, naturopathic doctor, and this is my lovely colleague, Dr. Tonia Winchester, also a naturopathic doctor. We both practice on Vancouver Island. I'm in Port Alberni and Tofino, and Tonia works in Nanaimo. Today we are going to discuss balancing your menstrual cycle.
Yes, absolutely. And I want to get started with a question for you. Can you tell us all about the different types of PMS and how hormone imbalances are connected to that?
Yes, so PMS is a very big range of symptoms, and it's divided into 4 categories. You may have one of these PMS types, or you may have many of them or all of them. So PMSA describes anxiety that comes along with right before your period, anxiety, irritability, mood swings. There is PMSC, which is food cravings, cravings for sugar. It also includes headaches and fatigue. PMSD is for depression. It can include depression, insomnia, confusion. This can be quite severe for some patients, and it sometimes is evidence of an underlying mental disorder. There could be an underlying clinical depression that is just worse before the period, so it's really important to get that diagnosed from a professional. The other one is PMSH, which is hydration, which is bloating, weight gain, breast tenderness. And there is other symptoms too that fall into PMS, like acne is another one that can happen right before the period as well. So that doesn't fall into any of the categories, but there are many. And they have a multitude of causes. So each woman might have a different cause of her PMS or a few causes. One cause is low progesterone, which can happen with stress. As we talked about in another topic, high cortisol lowers progesterone. So when you have a lot of stress, your progesterone will be lower that second half of the cycle compared to the estrogen. They are both declining, but if that progesterone gets too low, especially the anxiety and the insomnia can get particularly bad along with the other ones. Another one is low serotonin. This can happen too during PMS. Causing more of the depression part. Another one is low endorphins can cause it, and this can be boosted with exercise. That is one of the amazing thing to help with PMS is just exercising can really reduce the symptoms. And one more is low thyroid is a really big one, and it's often missed. And often a low thyroid condition can manifest as severe PMS symptoms. So as a naturopathic doctor, I would look for all of the potential causes. I do lab tests for thyroid. I do all of the thyroid hormones, T4 and T3, to look at if something is just slightly off, whereas often women only get TSH tested, so they miss sometimes the whole picture. If the thyroid is just even a bit sluggish, it could definitely contribute to these PMS symptoms.
Now, what do you do from a food, nutrition, dietary perspective to help people with their PMS?
There are 4 things I stress to avoid if you have PMS. So one is caffeine, and this includes coffee, chocolate, and black tea. Caffeine has something called methylxanthines in it. Now, not everyone is sensitive, but a large proportion of patients perhaps are sensitive to this methylxanthines. And what they do is they actually cause a bit of swelling of the ducts in the breast tissue and can cause more breast pain. So specifically for breast pain and fibrocystic breast, if that's what you suffer with, the caffeine, trying to cut that out for a few months could make a big difference. Another one is alcohol. So I stress to avoid it the last 2 weeks right before the period. So that last 2 weeks is critical when we want that progesterone to be a little bit not falling too low. We want the liver to be functioning optimally. So alcohol will throw off the balance of the hormones because the liver won't be as detoxifying as well as it could. So really focusing on reducing alcohol, and sugar goes along with that. Sugar is just as hard on the liver as alcohol. So sugar is any kind of sugar, processed sugar, refined sugar, artificial sugar, packaged foods with lots of sugar should be avoided. And salt. So salt will cause you to swell and be more bloated. So if you're experiencing more of that, like the puffiness, the weight gain, the bloating, reducing your sodium, which is again in all packaged foods mostly, and increasing your potassium, which helps outbalance the sodium. So potassium-rich foods such as bananas, avocados, lots of fruits and vegetables will be higher in the potassium.
Would you like to talk about nutrients and which ones might be deficient when people are struggling with PMS, and what supplements you would recommend to support people?
Yeah, so the two top ones that have a lot of evidence for them are B6 and magnesium, and often these work together. What they do is they help promote more serotonin in the brain, so especially for the food cravings and the depression part, the anxiety, the B6 and the magnesium can work great. At certain high levels that I would prescribe them as a naturopath, maybe higher than you would just get, obviously, in a multivitamin or just from food. So it helps with the biochemical pathways, helps with the neurotransmitter production in the brain. Another one that's been studied quite thoroughly is calcium for menstrual cramps. So I always give calcium with magnesium, so that together for the menstrual cramps, again, can help. And an herb that has been used for 2,500 years for menstrual problems is Vitex or chaste tree. A little violet, makes a violet flower, and the leaves and the flower is used. It's grown in Western Asia and Mediterranean, and now around North America it grows as well. It's been used for quite a long time for menstrual problems, and it has been studied more recently to see what it exactly does, because it does help with PMS. It helps with all of the symptoms of PMS. And what it does is it helps your luteinizing hormone, which is from the pituitary gland, that second half of the cycle, to help make your progesterone, to keep your progesterone levels balanced. So it can be taken throughout the cycle. You should consult with a professional, with a naturopathic doctor before taking it, because it is contraindicated with certain medications, with hormones. It interacts with birth control pills. It's not allowed to be taken when you're pregnant or lactating. So it's important that you seek professional advice with it. It is approved in Germany. Medical doctors prescribe it there. The Commission E has approved it for PMS. So the studies are pretty good with it. It's been compared to fluoxetine, the antidepressant, and it has been compared to birth control pills for the use of treatment of PMS, and it looks quite positive. So that's one that I often try for patients for PMS. So Tonia, tell me more about other menstrual problems and what you do to treat them and what they're caused from.
Sure. So, we've talked about PMS so far, so that's kind of leading up to the cycle. Now, there's a number of different types of bleeding issues that women might have. So I'm going to throw a few Latin names around here, but the first is amenorrhea. So this is when a woman isn't cycling at all. She's not having a menstrual period. And we might see this after, a woman has given birth and she's breastfeeding. But we also might see it if there's issues that are going on in the body, like cysts on the ovaries, and this might actually kind of block the menstruation. And then from amenorrhea, we can kind of see this spectrum of blood flow, regular or irregular. So next up would be oligomenorrhea, and that's when there's sort of an irregular, very scanty flow. The woman isn't really menstruating fully or completely on a regular basis. And again, this could be due to a number of different things, often thyroid, again, something like the cysts on the ovaries or polycystic ovarian syndrome might cause this as well. Next would be menorrhagia, and this is heavy bleeding that comes with the menstrual cycle. And this can be due to a lot of things as well. And again, all of these issues have many different causes, as Jeannie was saying about PMS. So it is important to get checked out and make sure that the root cause is being addressed. But menorrhagia is basically heavy bleeding. It could be due to something like a fibroid that's growing in the uterus. Next would be polymenorrhagia, and that is lots of bleeding all the time. So this is when there's bleeding, not just during the menstrual cycle, but maybe at spotting or maybe at ovulation, or maybe actually spotting or bleeding throughout the cycle. This could be due to a number of things as well. Also maybe a fibroid, maybe again thyroid imbalances. There's so many different things to consider when we're looking at a menstrual cycle. And so those are blood flow issues. And then of course there's dysmenorrhea, and that's painful menses. And some women have this extremely bad, and they might even vomit and have diarrhea during their cycles. That's a really extreme example. But this could be due to a lot of things too: inflammation in the body, stress, Prostaglandins are the molecule that sort of cause the pain and the cramping. There is, sometimes issues around, and I'll get to this a little bit later, but around how the liver is functioning. There's so many different causes. And when I think of a woman's menstrual cycle, often we typically would sort of separate that out from the rest of her body, but it's a system that indicates the rest of the organism, the rest of the body is out of balance. So everything needs to be balanced to have a balanced, healthy menstrual cycle. Everything from the gut to the stress hormones to the liver, the circulation, it's all important when it comes to the health of the uterus and the menstrual cycle.
Yes, for sure. And tell me, Tonia, how do environmental toxins play a part in affecting the menstrual cycle?
This is really big. We live in a dirty, toxic world, and I hate to be a Debbie Downer, but so much of what we're exposed to in our environment, what we're touching, what we're breathing, what we're ingesting is toxic. And many of these toxins have a very specific property called xenoestrogen. They basically are like fake estrogens in the body, and they go in and they drive these really intense estrogen pathways that exaggerate that progesterone deficiency that Dr. Jeannie was talking about. So these xenoestrogens are going to ramp up the estrogen, which is going to create a lot of those PMS symptoms, a lot of those bleeding issues that we were mentioning. Now, these are all processed in the liver, so we have to be making sure that we're A, reducing exposure to these things, and B, supporting the health of our liver so that it can properly function to break down these hormones or these fake hormones. So we see these in plastics, soft plastics and hard plastics. One of the recommendations I make to my patients is to make sure they are storing no food in plastic, so in glass, ceramic, or stainless steel containers. Drinking water out of glass or stainless steel is really key. And really just making sure that they are choosing organic foods whenever their budget allows, because then they're going to decrease that toxic load even further. It's a formula of toxins in, toxins out. And that's something that we have to be really, really watchful and mindful of when we're trying to help a woman and her period.
Thank you. And what do you do to help regulate a woman's cycle?
Yeah. And again, this is going to be different for every woman. Depending on what type of bleeding issue she might have, we're going to use different herbs. Depending on her toxic exposure, we might actually have to do a cleanse and a detoxification process for the woman. For some women, we can just kind of use whole foods, and that's a really nice way to do that as well. And we would cut out some of those triggers that you had mentioned as well. We'd take out inflammatory foods, so reactive food sensitivities, food allergies, that type of thing. But really I'm going to be working on the liver. That's probably my main target. And we're going to be introducing herbs that are going to help to process those toxins, help to break down those hormones. Some of my favorites in this category would be rosemary. It's actually one of my favorite herbs for this, and it has this really added lovely benefit of supporting nervous function, so brain function as well as the microcirculation. So we're getting nutrient delivery to the tissues, including the uterus. So milk thistle is another one that I would include. Dandelion is often one I would include, and this is something that you can actually just have in your salads at home. You can take dandelion leaves out of your backyard as long as they're not covered in fertilizer, and include those in your salads. The really lovely bitter leaf that's going to actually support the liver function. And I also really enjoy helping women, and I'll make different herbal blends depending on the woman's situation, and that's going to be very individualized. Chaste tree is one for me, and the Vitex is one that I use a lot. Dong Quai is another one, Angelica. But also there's something called the seed protocol, which is really neat. And this is basically taking different types of seeds, grinding them up and taking them at different parts of the cycle. So from the period to ovulation, we take pumpkin and flax seeds, and you would take about 1 to 2 tablespoons of these seeds ground up for those 14 days. And then for the latter part of the menstrual cycle, we would do sesame and sunflower and grind those up in about the same 1 to 2 tablespoons. This is a really neat way to start to regulate a cycle, especially one that's irregular. So those would be some of the things that I would work on with a woman. And actually, but really stress reduction, I have to mention stress reduction has to be part of this. And I often find that a woman's cycle is very reflective of the emotional stress that she has in her life. So that's one thing that we really have to deal with too.
we've talked about how cortisol, the stress hormone, affects all your other hormones. So stress is such a key thing to manage, to help with.
Yes, it's like a big salad. All of these hormones are just a big jumble that we have to kind of play detective and figure out what the key players are for people. And it's going to be different for everyone.